Hi, and welcome to Taiwan is Helping, the show where we talk about how Taiwan is assisting other countries, particularly in Latin America and during the COVID-19 pandemic. ICRT. I'm joined today by Dr. Shang-Ju Li, who has established a school in Peru and is also a public health expert. Hi, how are you today?
Hi, I'm good. How are you?
I'm great, thank you. Can you start off by explaining what public health is and what kind of issues fall under this category?
Definitely. Thank you so much. It's a great question. So, in general, the goal of the global public health or global health is to improve the health of all humankind. Mm-hmm. In the more political terms, so United Nations Sustainable Development Goal number 3, to ensure healthy lives and promote well-being for all and at all ages. Yep. So everything falls under this kind of definitions. Is global health is what we do. So what kind of categories are there? So I think every NGOs or every like a bilateral organization have their own agendas and priorities. Mm-hmm. Below is just one example that we used before. You know, there are 7 categories there. So health system strengthening. So we want to strengthen the current public health system to support universal health care, etc. Second is the health emergencies. You know, we support vulnerable populations or victims who suffer from natural disasters. Yeah. Third one is like non-communicable disease like hypertension, diabetes, or cancer. Mm-hmm. Communicable disease such as malaria, dengue, HIV, what else? Tuberculosis, etc. Another one is climate change. So what kind of health impact of climate change or other like environmental risk. Yeah. The last 2 is like data management. So we talk about like public health data, epidemiology studies, health management systems, so those kind of system development, and then the related data. The last one, talk about finance or governance and operation. So as you can see, it's very broad. So all kinds of like health-related aspect that impact the human health falls under this global health category.
Okay. Which of these specific areas have you been able to assist with abroad?
So I've been working with this my organizations in Peru, and then I'm currently working with another organization in United States. So most of our work are like health system related. So we help partner with the public health systems in the developing countries or sometimes developed countries, and then help them to improve or strengthen the current system and to better serve their populations or etc. So I would say health system is the kind of the most area that I've been working with.
And how have you been able to use your experience that you gained in Taiwan to help abroad? Why specifically do these places require someone with a different background in health education to go over and use their expertise to help out?
Great. It's a great question. So I am a trained physician in Taiwan. So I used to work in hospital for like 2-3 years in Taiwan. And then I left the country because I want to pursue this global health journey. So to be honest, yes, the knowledge I learned or the knowledge I gained through my work in the medical school in Taiwan, it was helpful sometimes, like talk about health systems, working with like the healthcare workforce, etc., to explain what is the public health insurance, to talk about different type of health system, etc. So that piece is actually it was helpful, I will say. But I have to say a lot of my experience was earned or learned from the field. So I lived in Peru for 3 years before I moved to the United States, started my MPH program. So the community actually taught me a lot of things. The public health system there actually taught me a lot of knowledge. I gained a lot of knowledge when I live abroad. So I would say like it's actually I think my medical training, it's just a start, start, and then I continue my learning through doing like while I live in Peru, and then I finished my MPH program at the University of Washington. So that actually helped my my field as well.
You said you spent 3 years in Peru. What inspired you to move there in the first place?
Yeah, that's great. So it's a great question. So people are asking me this a lot. So one thing I was thinking is like, okay, I can speak English, I can speak Mandarin. If I can speak Spanish, I'll be able to communicate with 70 or 80% of the population in this world. So I want to learn Spanish. So that's one. The second one is I'm obsessed with Machu Picchu when I was young. I really want to visit there. I don't know why. I just think that place I still am. I think that place is fabulous. So that's why I want to go. So when I decided I want to quit my job and move abroad, Peru and South America become my kind of first choice.
So you established a school over there, or you helped establish a school over there actually called Helping Overcome Obstacles Peru, which I believe also provides medical services and a lot of different things. Could you go into more detail about what the organization is and how it came to be?
Of course, of course. So Helping Overcome Obstacles Peru, so we call it HOOP, it's actually a community-based organization. So we do more than just a school. School is actually just kind of one of our core programs. So we actually partner with like the community. So we're calling ourselves is more like a community-based organization. So our business model is actually we work with community, make an action, engage with them, empower them actually. So let them speak up so to understand they can identify their own needs. What is the actual challenge, not just public health, but also the community challenges that they are facing right now, because that's their land, that's their livelihood. So we want to understand that piece. And then HOOP as a facilitator, we connect with external resource to work with the community to address the issues. So health is one aspect. So we do both the physical health and the mental health.
Yeah.
Lack of access to healthcare is one big issue for the community. So we have to help the program, help the community to have access to healthcare by several factors. One, so we work with social worker to try to register community members to the Peruvian public health insurance. That's one. Second is we work with local health ministry to increase the awareness of vaccinations, increase the awareness of all kinds of NCDs or communicable disease. And so we also work with the private sector, so some like clinics or hospital to run like free medical campaigns in the community. So we bring doctors and nurses to the community. So that's that. And for the mental health part, we have our own two psychologists and then two social workers. So we conduct home visits. So we identify high-risk family and then refer them to more specialized facilities. That's our health program. And we also have a community development type of program. So we try to work with the community that we talked about before, like, the empowerment, women empowerment, to work with the UN advisory group, and then trying to introduce what is human rights and then so conduct some kind of like microfinance programs and etc. So that is very dynamic. It's more like a committee tell us like what is the need for this year or for this time period. And then we try to connect with the external resource to do that. And then the final piece will be the education, because, unlike Taiwan, because in Peru, there's a huge gap between public health education system and the private education system. So, people middle class above, they usually send their kids to private education. So, because you get a better opportunity after you graduate. The community workers, they don't have this privilege, so we're trying to kind of introduce like a reinforced programs or provide scholarships to help the kids to receive, better education, so that they can kind of break the vicious circle in that area.
You said the program is about empowering the community to identify gaps in the health framework or perhaps gaps in the social fabric. Was there anything specifically the community said that they needed from you that you helped provide?
Right. Great.
Specific examples.
Yes, definitely. So one example I remember is, I think it's in 2018. So the community actually decide they want to work on the environmental health. Because, what's that reason? How do I explain this? So it's mining areas. So behind the communities is actually a mountain. So a lot of the companies that will go in there and then just take the sand or the rocks that they want and then leave. And then it actually kind of destroy the landscape, and they also create a lot of dusty and create a lot of like garbage and waste that kind of contaminate the air and the water in that area. So a lot of the kids were actually getting sick at time. And they also like the garbage car, like the truck didn't come very often. Nobody actually care about the environment. Because the Ministry of Health, they don't care, etc., etc. So they decide to, this has become an issue in 2018. So we actually launched a lot of different campaigns to try to raise this is issues to the ministry. Tell them like, okay, so somebody needs to come in and then have to clean the regions, etc. And then we also work with the community members to actually launch a bunch of like a community cleaning activities. Trying to make sure everything's okay. We have a water for kids, and then they have a clean air for the kids, so that kids can play around, something like that. So that's just one example. The community actually tell us like what they want to do, and then we kind of help them to channel it to the right place or find the right solution.
Now that you're in the US, how involved are you with the program still?
Right. So we have our headquarters is actually one base. Our base is in Arequipa, Peru, and then we have several supporting office. Office in many countries. So we have in Taiwan, we have in France, we have UK, we have Austria, many different places. So we are in this kind of supporting role, trying to make connection with people, recruiting volunteers, identify like funding opportunities, and connect resources to just trying to support our office in Peru. And I'm trying to establish a HOOP USA here. Just finish the registration, and then we will be able to proceed like fundraisings and grants writing, and then provide support. And I'm still trying to help them like in terms of like grants writing or proposal development or public health experts, something like that.
What do you think is the biggest success story to come out of the program?
Of course. So a couple of things. One is at the beginning, we have 5 founders, co-founders. So only one is Peruvian. The rest of us are like foreigners.
Okay.
And then now we have a 100% Peruvian board, and we have 7 full-time Peruvian employees. So our goal is like we want this organization to be like local, because we want to make sure that it's sustainable. Like we want the community, and then the community can run this organization. They could be part of the management and the operations. They're not just the beneficiary, but they are also part of the organizations. Yeah, that's actually our goal when we set this up at the beginning, back to 2012. And okay, so I would say this part is we learn a lot. There's a lot of back and forth, challenges, etc. It's a long story, but I'm pretty happy that we'll be able to kind of present like, okay, now we have a full-time employees in Peru, they're all Peruvian, and then they are from some of them are from our community, some of them are not, but at least they are all in the region, so they know people, they know the culture, they have the history, etc. So that's actually kind of cool in my mind. It's like we be able to establish this, and then it's sustainable, and then now the community and then the citizens there are actually getting engaged. The second thing is the connections between the organization and the community. Like we at the beginning, like back to when I arrived, like back to 2010, something like that. Yeah. It was like more like a give and take kind of relationship, a lot of foreigners came, and then people gave, and then the community member kind of they are the receiver. Yeah. They just
sorry, just to interrupt you for a second. Where specifically in Peru is the organization based?
Okay.
Is it in a remote area?
We are in the close to the city of Arequipa. It's in the south. It's the second biggest city of Peru, and then we work in the outside of the city. It's like a develop. We call it Pueblo Jóvenes. Pueblo Jóvenes. So it's like a new developing communities.
Okay.
It's a more political term to say, and it's just outside of the city, like for economic migrants or low-income families. They don't have the resource to live in the city. They would just live outside. So that's kind of like it's kind of like the same design, like, you know, city development, like in urban development in South America, like the rich people live in the city, and then the surrounding area just like all like, you know, poor people and farms, etc. So we work in those areas.
Has the pandemic had any impact on how you operate?
Yes, it has a serious impact of our operations, not just our operation, but to the community as well. For the organization, yes, of course, the funding issues. So a lot of funding are cut because many reasons. And then a lot of volunteers couldn't travel. Our staff can't travel either because the curfew. Yeah. So it makes program very hard. Like a program is just very hard to run program in remote areas. Because a lot of our work requires, you know, face-to-face or home visits or this kind of approach. So going online makes things just a little bit harder, you know, like especially not everybody has internet. So think about this, like if you're, you know, a family who lives in this area, they probably only have, you know, 5 soles, which is, you know, dollars for the entire family. You have some WhatsApp or something like that. So the internet connection is just not good. So running a program like that, it's just very challenging. Okay. So for community, it's even harder because of the pandemic. There's a lot of like misinformation, so a lot of fake news floating around. You know, talking about like there's chips in microchips in vaccine. It's all government's plot trying to control people or whatever. So there's a lot of information floating around, and community members sometimes are just very confused because information could come from so many different aspects, you know, come from radio, come from WhatsApp group, coming from neighbors. So they don't know what's right, what is wrong. So to be able to trying to address those issues, you know, trying to tell people what is right information, it's also a challenge as well. So yeah.
Well, my final question is going to be, how have you tried to overcome these organizational and community issues?
Right. So for the organizational issues, so we are trying to you know, apply for like a public grant. So we received like a German government give us like some grants to run like a cooperative programs. Okay. And then right now we are trying to work with another group in San Francisco and Seattle area to build some kind of like robots for WhatsApp group, so that to tell people what is right and so what is wrong, what is fact.
Oh, interesting.
Something like that. So yeah, Taiwan used to have that. But anyway, so we're just trying to fight the fake news and etc. And then right now the curfew is lifted, so some of our social workers and some of our community members will be able to go back to the community, you know, like with all full protection. So they'll be able to reach out to the community again. So something like that.
Okay, well, thank you, Dr. Li, for speaking to me today, and I wish you all the best with the continuation of the program and your work in the USA as well.
Okay, thank you so much.
Thank you. Bye-bye.
Bye.